And the third piece then is structure. And again, I use that same term, and because when I think about family health routines, I think about structure. If I think about my own habits, I ask you to think about your habits. In fact, I'll ask you to think about somebody you live with, their habits about breakfast. Can you think about that? Could you, if I was to interview each of you individually, could you tell me about whoever it is you live with, their routines around breakfast? With a fair amount of accuracy. Could they tell me about yours? Well, you're not quite as sure about that, but you think maybe they could. All right. And what I found when I've done my research is that women are the health providers. They're many times the gatekeepers in families, at least in Appalachian families, and I think it's broader than that, and not just American culture, but probably many international groups as well. And so when we begin to talk about structures or routines, they're habits, they're patterns, they're things that are repetitive that go on in families. Now, this is the most interesting part to me of this model, because if I'm a nurse and I want to change behavior, going back to the idea of transition and change, what am I going to change? We all know, and I'm sure that everyone in this room knows, because you've read the literature about something, that we know education doesn't make a difference. Education helps. Education has potential to make difference. But how many, and I'm looking around and I see lots of bottles of water, so you're all pretty conforming. A few of you have Coke with sugar in it, right? And I don't know, but maybe if I followed you out on the break and followed behind some of you, maybe some of you use tobacco. All right? I walk down the halls in a hospital and I see nurses that are a little bit overweight. In fact, where I live, there's many nurses a little bit overweight or very much overweight. So based on that, what we do know is that knowledge is not enough. Just teaching people doesn't change behavior. There's other things. And we have all these psychological theories then about how to change behavior and what motivates people and all of those kinds of things. Well, we're not therapists. In Ohio, my Nurse Practice Act says I have to be a counselor. Now, a counselor is not a therapist. Right? I'm not going to have time to do that kind of therapeutic counseling. But you know, it's amazing how much counseling I can do rather quickly when I say to someone, you know, you're diabetic and you're going to need to change. You know, you need more exercise. Well, that's a turn off. Don't tell someone they need more exercise. We all know that. We don't want to even discuss it, right? And so patients are the same way. But if I say to them, tell me about your routines, your physical activity routines. Well, that doesn't usually take very long because there's not much to tell about. And then, but I can begin saying, well, you know, based upon what you know about your disease, how might you need to change that? And they can begin telling me about that. And then I might say something like, are there particular things you might do? And they can usually name those. And then I can say something like, what would it take for you to take some steps to do that? And they can actually respond to that. And it's then something that they can take home with them and actually talk to other people about in the family. And we teach most of the time as nurses as if people have individual diseases. But the reality is most of us live in a family. Now that family may be a temporary family. It may not be a family that's legitimized by society for some reasons. It may not be a family that is structured in the way other families are. But we live for periods of times with groups of people who become either family or like family to us. And in that family context, then, we have to live with our diseases, our illnesses, or our ideas about health promotion. And we can only do that, or I guess I should say, we do that based upon patterns we create, habits of our lives, and we all have them. And what we basically need to do is create healthier habits. And I think that's what family health routines are about, creating healthier habits. And it's something people can easily recall. They can talk about how changes could be made, and there are things that we can measure. We like that, right? things we can measure, things we can evaluate. If I do an intervention, I can evaluate whether it worked or not. They can evaluate whether it worked or not. It's not using medicalese. It's not language that people don't understand. It can become very up close and personal to them. So it just seems to me, after all of these years, that family health routines make sense. All right? It's just how do we incorporate that into the work that we do.